Hello and welcome to Health Digest, dedicated to International Women's Day. I'm Ogom Ezedimbo. Today we focus on the fundamental issue that continues to impact women worldwide, health equity. But before we dive into this, let's quickly bring you our health news.
On health news today, the federal government has outlined its plans to reform the healthcare industry with a focus on policy reform, infrastructure development, and financial mobilization. Speaking at the third annual conference of the Healthcare Federation of Nigeria in Lagos, Dr. Abdul Mukhtar, the national coordinator of the Presidential Initiative for Unlocking Healthcare Value Chain, emphasized the need to strengthen Nigeria's healthcare value chain. Dr. Mukhtar noted that Nigeria currently imports 80% of its medicine, vaccines, and healthcare products, and highlighted the government's goal of reversing this trend. The federal government is also creating employment opportunities through resource mobilization and foreign direct investment, Dr. Mukhtar added. The National Agency for Food and Drug Administration and Control, NAFDAC, has disclosed the stoppage of its registration of multi-dose anti-malaria dry powder for oral suspension. The agency, in a public alert on January 2025 posted on its website, stated that the regulatory step was taken due to the instability of the reconstituted formulations, which can lead to a loss of efficacy over time. While stating that the suspension of the drug applies to all locally manufactured and imported ones, the NAFDAC maintained that it would no longer accept new applications, renewals, or variations for its product. It pointed out that stability studies have shown that once reconstituted, the artemether-lumefantrine oral suspension becomes unstable, which can result in a loss of efficacy and could lead to worsening health conditions, increased risk of a complication, treatment delays, or even death. The NAFDAC directed all zonal directors and state coordinators to carry out surveillance activities and remove all locally manufactured and imported products from circulation. The Minister of Health, Professor Mohammed Ali Pateh, says the work done by Governor Umo Eno in reforming the state in such a short period of time is amazing. Pateh stated this while performing the inauguration of some key health facilities in Uyo, the Akwa Ibom state capital. The coordinating Minister of Health, Mohammed Ali Pateh, was very impressed by the array of critical health infrastructure lined up for him to inaugurate.
You're picking health as one of the pillars of your Arise agenda. I think it says a lot about your vision, but your intent for the good people of Akwa Ibom State. I want to thank you. I want to congratulate you for this amazing work. His Excellency President approved that we source $1 billion in concessional financing, primarily to incentivize improvement in primary health care, working through states. All the states in the country have expressed interest. Akwa Ibom, I assure you, Your Excellency, you are part of that movement to revamp primary health care in Nigeria.
Governor Umo Eno said the facility was in keeping with his campaign promise to boost healthcare delivery system in the state.
The formal unveiling of this facility, one of such that we are doing across all the 31 local government areas in this state, continues to validate our campaign promises that we're going to provide healthcare to the rural people and to make healthcare accessible to all of our people.
Other facilities inaugurated included the medical oxygen production plant at General Hospital Ituk Mbang, the Ministry of Health Emergency Operations Center at Akwa Ibom State, and the Emergency Medical Service and Ambulance Systems at the Dakada Secretariat, Uyo. That's it on Health News. I am Chidera Ezudoi.
If you're just joining us, the program is Health Digest. The theme for this year's International Women's Day calls for equity, inclusion, and the world where every woman has access to quality healthcare, free from bias and barriers. And yet, for millions of women, this is still far from reality. Why do these disparities exist, and what can be done to ensure women receive the health care they deserve? To discuss this, I'm joined by Ramatu Ada Ochekliye, a storyteller, advocate, and the portfolio director of Shades of Oz, an organization committed to using African stories to drive social change. Thank you so much for joining us.
Thank you so much for having me. It's a pleasure to be here.
Health Digest today. Let's quickly talk about the power of story in driving change. We're talking about International Women's Day. Let's begin from there.
Oh, stories are so powerful, and I'm sure we all grew up in that time where there was Tales by Moonlight. If you remember that, there was a point where everyone was watching Tales by Moonlight, and even before Tales by Moonlight, we had, families that will sit under the tree with their grandmother, and then they will tell stories. And stories are so powerful because they make you imagine a world that is outside your immediate environment. So we have looked at storytelling in my life as a person. I had Oprah, for example, who was talking about her life. She was talking about abuse, and that was what sparked that desire in me to, address abuse and, things that happen to women. And she did it by telling a story. And stories stay with us longer because people love to hear. It's like a gist. If you and I sit down now, we are gisting and laughing and talking. It might just spark that desire in you to want to create something. So we realize that storytelling is such a huge way to reach people. And what we do is by using podcasts, for example, where people listen, using film. We have a mobile cinema project where we use film and address socio-economic issues. I remember the first time that thing was sparked in me was when Stephanie Okereke did the film Dry. If you remember, that was addressing early child marriage. And I said, oh, yes, we can actually address social issues using film. And that's what we do, telling stories to ensure that people understand that this thing that may seem very complex in our society can be broken down in the simplest story so that people can connect to it, can see where they can take action and where they can make changes in their society.
Now, talking about women's health, how can storytelling highlight the barriers?
Oh, it's very important. A lot of women, first and foremost, do not know some of the basic things about their bodies. Many women do not even know even things like periods, where you think, it's such a simple thing, but some people do not even know their circle. They do not know that, okay, their body will change. They do not know that sometimes within your ovulation period, there are some things that might happen and things like that. Do you know your ovulation can affect your tooth? And I had a particular experience with that, ovulating and my teeth flared up. I had to go to the hospital, and the doctor said, wait until after your ovulation and let's see whether the teeth problem will continue. Some women even lose their teeth during pregnancy because of the increased hormones in their body. So when you use, for many people, when you hear the name, maybe the hormone, you hear oxytocin, you hear this, it seems too far. You now find a way to use stories to explain, your body will change. This is what you feel in your body. This is what you feel when maybe you have headaches, you have diarrhea. And I love the fact that we started talking about it on social media. It used to be a taboo. Before, you don't talk about your period because people would think, it's something you need to be hush about. But now women are talking about, and women are learning about different kinds of ailments. They are learning how to use either natural or medicine to address some of these issues that people, and then even childcare. Some women don't know that while you are carrying a baby, there are some changes, there are some things you don't need to take. Maybe your doctors will tell you, you need to have antenatal. Some women don't even know that they must go for antenatal. They just feel it's pregnancy. Millions of women do it every day. And they don't know that going for antenatal will give you the opportunity to, one, make sure that you are okay. Make sure your baby is okay. Your baby is getting the right nutrition. Your baby is the right weight. Your baby is, they're testing. And right now we can even test for some diseases in a child while it's still a fetus. So if you don't use stories to tell some people because of educational levels, exposure to things, some people may never know this. And that's why we have maternal mortality in Nigeria as the third highest in the world. And Africa as a whole has the 3 countries with the highest maternal mortality rates. It's because there's no exposure. And if you want to start telling them all the complex names of these things, it might not hit the mark. So the best way to do that is to use stories to tell them.
Now, you have an experience in storytelling, and you know the way it is in low and middle-income countries, in our rural areas. What could be the barriers, accessing care? What are those gaps?
The barriers are plenty. I always tell a story of the time while I was serving during my youth service, and I was in a town in Garkida. I went to see a friend, and I saw a woman coming from far. Something just made me, focus on her. She was coming from far, and the way she was walking, you could tell something was disturbing the woman. And I just stayed looking at this woman. By the time she finally got to the primary healthcare center where my friend was a doctor, she was in. I didn't go in with her.
Okay.
I was on the opposite end just watching. And like 10 minutes later, she was out. She just walked a little bit, cut a plant and placed where she had backed her baby. And that was when I didn't know what it meant until I now asked my friend, why did she do this? She said, oh, her baby died. And she had just given birth to that child. Because she didn't give birth in the hospital. Now there were complications. The baby had problems, and the baby died in fact, she came after the baby had died, but she didn't know. It was a last resort for her to try and save that baby. But it could not be saved because the baby had died. And when she put that leaf in her back and was walking away, she was just a picture of sadness. And what was that barrier? The first understanding that antenatal care would have detected some problems. Sure. But it's not just finding that antenatal care. Even the primary health care center that she was coming to, which was the only primary health care center at that point in Garkida, that primary health care center could not do so much for that woman. So there is the fact that the woman didn't know about things. There was the fact that she didn't give birth in the hospital with skilled attendants. But there was also the fact that even in the hospital, there were not many skilled attendants that could have handled her case. And even if there were complications, my friend who was working there was also using touch phone lights, the touch light from his phone, the flashlight, to do certain surgeries. So it still meant that there was another barrier on this. Long distances, women having to trek long distances to access care is a problem. Poverty is a problem. The healthcare facilities themselves are a problem. The lack of skilled health workers are problems. The fact that, as a nation, if we must improve, we must invest in primary health care, because not everybody will live in the city. Not everybody is able to even afford the things in the city. Because, even you want to give birth today, they'll tell you to go and you prepare a box where you have your consumables, you have things that will be needed for your stay in the hospital. People who go abroad to give birth, they don't need to build that box. The hospital provides it for them.
Sometimes we even arrange our boxes like a month, 2 months before we go to the hospital. Yeah.
But you see, these people who are poor, who don't have the opportunity, who don't have the money, because they'll always think, if I'm living on less than 500 naira per day, the idea of going to spend maybe even 3,000 naira in the hospital will be very, very heavy for me because I'm living on 500 naira per day. So there are so many indices, so many things that cause women to die from childbirth. And these things are, there are things about knowledge, there are things, that's the knowledge gap, there are things around the facilities themselves, the healthcare themselves, which is on the government side. And there are private sector that should be considering investing in it, but the private sector will always think of, how will I make money from this?
Profit maximization.
That's where the government needs to also come in, right? So there are so many problems, and it really will take time to address a lot of them.
So what you're saying now is that we have a gap in our health system?
We have a big gap, if we're being honest with ourselves. Ideally, in a country like Nigeria, your general hospital is supposed to be your best hospital. The most affordable, yes, but it's also supposed to be your best hospital because you have all of the specialists, you have all of the consultants, you have the people who have improved their knowledge providing services there. But the problem now is, if I go to a general hospital, I have to go to the point of payment, which is usually far from the point of care. And because there are maybe 1,000 other people going with me to that and I recently was at, the Maitama General, and I saw lots of people too. Same thing. You have to go to the point of payment to register, then you go to the point of care and sit down and wait. And you might have to wait for 2-3 hours before you see a doctor, and you might be in a lot of pain. Imagine a woman who is in a lot of pain, but she has to wait. By the time she finally sees her doctor and he maybe prescribes something, we have seen how medication has gone up. The price of medication, like every other thing in the country, has gone up. So these are the problems that we are having back to back to back that we really need to find a way to resolve. There is a huge gap in the healthcare, and it's something that I love what the current minister is doing. He's trying to bring a sector-wide approach so that we're improving the sector across board and all of the sectors that link to it, and I like that. But it's going to take dedication, commitment, accountability for these things to actually happen, and for the masses to actually benefit from the healthcare services that we desperately need.
Now, this year's International Women's Day is not just about recognizing challenges facing women across the world, but we're also looking at how we can find lasting solutions to all of this. How can storytelling help to drive policy change?
Yes, so I really love this question, because storytelling, to change any society, if you look at it, any society, if you look through history, before you change that society, you start with a story. Now, the story may be good or may be bad. Now, think of, for example, what was happening in Germany during Hitler's time. There was a deliberate statement saying, oh, foreigners are not good, we need to kick them out, we are a better race, we should do. And then the people bought it. And when they bought it, they now took action and carried out bad acts against people who were living in Germany. The same thing in Nigeria. When you have you want to say, oh, Nigeria can be great. Or let me use America. America is the greatest nation in the world. Why do we think that? Because we watch TV, we listen to music, we listen to everything that glorifies America as a nation. I never knew for the longest time that Paris had terrible streets, rats, and dirty. I never knew.
Until you got there.
Until I saw a story.
Oh, you saw a story?
That where someone was filming parts of Paris that had rats, huge rats. All the thing I had seen about Paris before then was this beautiful, romantic city that everybody wants to be in. So in order to change people, you first need to tell them, let them visualize that thing. That's why I love the two films that we did, Flo and Umi. Flo was about period poverty, and we saw women saying, oh, so we need to know our body. It's a simple thing. You don't have to be the most educated person, but you just need to know your body and know what you need to do to take care of your body. And then with Umi, we're like, oh, we need to improve primary health care. And when these things happen, you and I can easily demand for better. When people have an understanding of what they need, they can now ask their leaders, oh, instead of giving me onions and pepper during election time, how about you build a hospital in your community? And we saw something, what's his name, Bello something, he's a TikToker, who, talked about education in Kano State and showed how by putting in his own money, they could, I think with 5 million or 10 million, they were able to refurbish a school block. And the government picked it up. They were angry with him, yes, but they picked it up and they said, okay, we would work towards improving some of our school systems. So stories ignite the people. It's not the policymakers, it's actually the people. Because when you ignite the people can demand that the policymakers make better policies for them. And that's what we want to do with our stories. Let the people see, oh, this thing can be better. And if it's better, I can now ask my leader, okay, how can you make healthcare better for all of us? Because if we do not collectively ask our leaders, they will not do anything. Sure. So when we see what happened with the Kano State school issue, until people were outraged before the government was like, okay, we are going to pick this up. So we need to first ignite the people to understand that things can be better. And once they understand that, they will demand more from their government. I didn't care about politics before. I was like, oh, I just want to help women as much as I can. But I realized if you keep helping, and there are no systemic structures to ensure that this thing you're doing is sustainable, you will be wasting your time. So I started to understand my government, understand what are the laws that support, what are the laws we can advocate for, and things like that. And what do? Ignite the people, and they will demand accountability from their government.
So let's come back to we media. We do tell stories, content creators, journalists, and the rest of them. How do we better amplify our voices and to demand for better health for women?
Oh, I believe in collaboration and partnership. I do not believe in reinventing the wheel.
I don't believe that you should be in a silo. Work with the government, work with people who are doing similar things with you, work with the people who you want to benefit from that program. If the media shows people agitating, we saw what happened in the Arab Spring, what happened starting in Tunisia, I think. It was with the cameraman who trained his camera on the guy who set himself on fire and started the revolution. Not everybody had that same shot. The one person who did that was amplifying the work. And I always say it for every other thing. It doesn't need to be a bad thing. Sometimes you can amplify the work of somebody doing something different. And we have seen that there's a lady who does STEM technology to check heart rate. What's her name? Is it Kemi or so? She uses technology, and we had to do a write-up. We wrote about her so that more people will see her. And it is about that collaboration. Once you collaborate, you are better able to amplify the ideas that can improve society, because millions of people watch you every day. So it's a good thing for me to be here and talk about women, and maybe a woman has learned today that, oh, okay, periods, I just know my body. If she picks that from me, you have amplified my message to millions of people, you understand? So it's very important that we collaborate, we partner, and we understand the communities that we want to reach. No need to reinvent the wheel. If somebody is already doing something, how do you strengthen that person? Instead of saying, oh, I want to do my own, no, I want to be seen. No, partner, collaborate, and we will make the world a better place.
Let's look at the policymakers, those in authority, health professionals, and you and I, what we can do to make women's health a priority.
So again, and not necessarily for political reasons, because I actually read the document of the current coordinating minister of health. And personally, because I read that document, I'm very idealistic. I like to believe the things that I see. And all of this came because there were certain people who advocated, and that's the last part of storytelling. So storytelling is a sort of activism, but then advocacy is now to your policymakers. Now your form of advocacy might be to invite maybe the Senate leader on health to come and talk about the importance of health for women, and that's a form of advocacy. Another form of advocacy might be we choosing to go to as a coalition of non-profit organizations to meet the Minister of Health to say, okay, these are ways we think we can improve the lives of women and children. And advocacy is not something that happens one time and then it's done. Advocacy is continuous. It's also knowing that you need to connect to what is happening in the country. Like now, I don't want to do anything outside of the health policies that we have in Nigeria, because it is when we work with the health policies that we can improve the health policies. I remember 2018 or so, I contributed to some of the policies for adolescent health. I was very proud of myself to do that, and thankfully the organization I worked with then allowed me to do that. But we also have to play our part. It's not just saying, oh, things need to be better. How are we trying to make things better? Contributing to policy development, contributing to policy formulation, and better than that, contributing to policy implementation. Because we see something like the Child Rights Act that was done. Some states did not domicile it for a long time. And what did non-profits do? They were doing constant advocacy for the states that finally domesticated it. And when they domesticated it, you show them that you are proud of them. And when people like just a simple thing like, oh, some person is doing so well, they want to do more. You understand?
Now, before I let you go, I'll need you to talk to Women's International Women's Day we are celebrating. Talk to them about their health.
I especially want to tell women that your health matters. I always say this, and I feel like a broken record saying it, but your health matters. First, you matter as a person. Second, your health matters. You need to know yourself, know your body. Test before you treat. Get vaccinated. Look for the opportunities for you to be well. And these opportunities are many. Eat healthy, exercise, get vaccinated for vaccine-preventable diseases. Go to antenatal if you're pregnant. Ensure you complete all of your antenatal visits. Ensure you have a skilled birth attendant, help you give birth. Try to give birth in a health facility as much as possible. But most importantly, all of this starts with knowing yourself and knowing your body. If there's a change in your body, track it. If something is happening that is different, track it. Don't self-medicate. That one, we usually, you just get sick and you say, no, let me just quickly take something. Don't self-medicate. Go and get tested, then get treated based on what you're tested for. And if you do this consistently, you're more likely to have a healthy life than otherwise.
Okay, thank you so much, Ramatu Ada Ochekilye. Have to take my time to pronounce that name. Ramatu is a storyteller. She is an advocate, and she also the portfolio director of Shades of Us, and organization committed to using African stories and to drive change. Thank you so much for
Thank you so much for having me.
Okay, and to all our viewers, as we celebrate International Women's Day, it's on the 8th of March, and just a few days from today, we want to tell you that women's health is a human right. It is not a privilege. It is something that they deserve. My name is Ogom Ezedibo. Thank you so much for being a part. Stay safe.